How's it going, guys? Past level question for Pharm Step 1 Internal Medicine 2CK. 23-year-old dude, he's got blood in his urine and he had recently traveled through Africa. And then you have this image here where you don't have to be a microbiologist slash pathologist to know exactly what you're looking at. But this type of image where you see what appears to be maybe an ovum slash egg, and then you see this little spiky thing, it's called a spine, okay? This is classic for helminth infection. All right, so not very difficult because all the answers are helminths anyway. How convenient, right? But then I decided to add a little bit of difficulty and just throw in, well, which anti-helminthic agent are we going to use here? So let's just hop through the answers. Choice A, Chlornochus sinensis, wrong fucking answer. So this can cause cholangiocarcinoma, portal hypertension. Cholangiocarcinoma is bile duct cancer, exceedingly low yield for USMLE. I think it shows up on one NBME form in history. Okay, I do mention it in my micro modules, okay, because if I don't mention it, then students will be like, Mike, this showed up on the NBME. This is high yield. It's not fucking high yield, okay, but wrong fucking answer. Choice B, Paragonymous westermani, wrong fucking answer. Also low yield garbage, okay, but count on me to mention it in my micro modules, okay? We're talking one-liners here. We're not talking like lengthy discussion of stuff. So this can cause hemoptysis. You get it from crab meat, okay? Chlornochus sinensis from fish, but Paragonymous consumption of crab meat. Wrong fucking answer. Choice C, schistoma hematobium, correct answer. So classic scenario of squamous cell carcinoma of the bladder secondary to schistosomiasis, and it's hematobium as the species, okay? So they're going to tell you backpacker went swimming in freshwater lake in Africa and then comes back months later, has blood in the urine, okay? And then they can show you a very similar image such as this, and the answer is just squamous cell carcinoma of the bladder. It's not dramatic. It's not difficult. It's past level, as I said, but we have to check off the boxes on these things. So the worm, it's a trematode. These are all trematodes I've mentioned so far, which mean flukes. Okay, I can get into a very annoying discussion for everybody involved. Nematodes are your roundworms. Cestodes are tapeworms. Trematodes are flukes. Okay, so it's a fluke that can live within the cystic veins draining the bladder, also within the bladder wall itself, can leave eggs that calcify. It can cause granulomatous disease. Okay, so how about I answer which drug it is? Okay, what am I doing here? I'm going to do that, okay? So it's going to be praziquantel. You need to know praziquantel is your classic anti-helminthic agent that targets most trematodes and cestodes. Are there exceptions? Yes, such as neurosis cirrhosis caused by Tiniosolium, a cestode. You can sometimes use albendazole for that. No one gives a fuck, okay? Praziquantel, it's asked on USMLE in terms of anti-trematode cestode agent. There is an NBME question floating around where they do something very similar, I believe, for schistosoma mansoni. Okay, so mansoni slash japonicum. So mansoni and japonicum, those can cause portal hypertension, and very similar looking ovum with the spine actually coming off the side rather than at the tail. And you would also treat with praziquantel, and they have mebendazole as a wrong answer. So mebendazole is for nematodes classically. Praziquantel causes worm paralysis. Mebendazole is one of your antimicrotubule agents. So we think about antimicrotubule drugs like the bendazoles. Don't confuse with azoles, the antifungals. Okay, we're talking about bendazoles, anti-helminthic agents, griseofulvin, antifungal, colchicine, paclitaxel, docetaxel, taxanes, vincristine, vinblastine. Okay, so high yield anti-microtubule agents. Schistosoma mansoni, wrong fucking answer. Choice E, Wuchereria bancrofti, wrong fucking answer. So this causes elephantiasis, okay, not elephantitis. It's not inflammation of an elephant, so lymphatic obstruction slash insufficiency leading to a massively enlarged limb, and it's spread by a female mosquito. Okay, and then you would treat that with praziquantel also. So all these helminths are treated with praziquantel, and yeah, female mosquitoes spreading Wuchereria bancrofti. The schistosomiasis species are just going to enter through the skin. Okay, so they're actually snails are the reservoir. but they still enter through the skin. Choice E, wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe to my channel. And I appreciate your time. That's it.